The following presentation is presented by Montgomery County Department of Health and Human Services regarding the updates to the ServicePoint application. If you have questions following the presentation, please contact the County Help Desk at helpit@montgomerycountymd.gov. The purpose of the update is to inform you, the user, that there are two new pieces of information being collected on clients in the ServicePoint application. These questions help the county to understand better the medical history of the clients being served and are factors in the county's definition of vulnerability. The Vulnerability Index helps us to rank our homeless neighbors and understand who our most vulnerable clients are. Presently, Montgomery County captures most of the information that impacts vulnerability. However, these two pieces of information were needed to have a more complete picture. During this presentation, you will learn what and where the questions are, why we are capturing the information, and when and where to answer each question. We want to have consistent information on all clients, so all program types are being asked to capture this information. However, it is most imperative for the purpose of understanding medical vulnerability and making housing decision placements based on that medical vulnerability that the information be entered for those clients in emergency shelter, safe havens, and street outreach. The first question is an assessment question. It is worded, total number of hospital admissions in the past 12 months. The question is intended to capture the number of times the client has been admitted to the hospital during the previous year. What we are after are actual physical and/or medical conditions that are being managed through hospital admissions. This is not intended to capture emergency room visits where the client is examined and immediately released, or where the client may be sheltering at the emergency room. It is also not intended to capture mental health hospitalizations. The information will be captured on the APR entry, APR exit, medical, and path assessments. It is expected that this question will be asked of clients at the initial point of enrollment to your program, which we commonly refer to as at entry, and when a client completes your program, or at exit. If you receive updated information between entry and exit, please update this question on the Assessment tab. For information on how to use the Assessment tab to update client information, please ask your agency administrator or contact the County Help Desk. Let's take a look at how the question is asked in the software. The assessment question, total number of hospital admissions in the past 12 months, has been added to the APR entry, APR exit, medical assessment, and path assessment. The question is an integer, and so only numbers can be entered into the space provided. For instance, if you knew a client had no hospital admissions in the past 12 months, you could not type the word NONE in the box. Nothing would happen, but it will accept a 0. Only type 0, however, if you know that that is the answer. If you don't know the answer, leave the question blank. If you need further information on the question, you can click on the question for a question description. If you leave the question blank and attempt to save the information, you will get an encouraged answer alert saying, it is strongly recommended that you provide an answer for the following questions. Total number of hospital admissions in the past 12 months. Then it will ask, would you like to answer these questions now? If you left it blank intentionally, click the No. All other information on the assessment will be saved. If you left it blank accidentally, click Yes, go back to the question, and type in the appropriate answer. Now for the second question. A sub-assessment question has also been added to the disability sub-assessment to get more specific information about which conditions a client is suffering from. Presently, if a client has several physical or medical conditions, only one disability sub-assessment would be added to cover all of those conditions. Now, you should enter a separate sub-assessment for each condition. For example, if a client has diabetes, heart disease, and chronic asthma, 3 sub-assessments with the disability type physical medical should be entered. Having this level of detail will help the county to understand better the complex medical conditions and challenges clients are facing and make appropriate housing placements. Because the question is part of an existing sub-assessment, it has not been added to specific assessments. Instead, it will now be included wherever the disability sub-assessment is displayed, including the APR entry, APR exit. Like the first question, it is expected that this question will be asked of clients at program entry, program exit, and any time you receive updated information between entry and exit on the Assessment tab. Now let's take a look at this question in the software. The new disability sub-assessment question. If the above disability type is physical or physical medical, is the condition one of the following, has been added immediately following disability type in the disability sub-assessment. This means that anywhere you see disability sub-assessment, you will now have this question to answer. If you choose a disability type of physical or physical medical, you are then prompted to answer the sub-question. Click the drop-down and there are many options here. If the specific condition that the client is suffering from is not mentioned here, choose Other as the physical or physical medical condition, and then answer that question in the notes. For instance, if a client has chronic asthma, choose Other, and then in the notes on disability, type chronic asthma. If, however, the condition is one of those listed, such as hepatitis C, you do not need to type anything in the box selected. If you are filling out the disability sub-assessment and the appropriate answer is something like alcohol abuse, then do not answer the disability type physical medical question. Instead, continue with all of the other questions required and click Save. When you click Save, you will get an encouraged answer alert stating that it is strongly recommended that you provide an answer for the following questions. If the above disability type is physical or physical medical, is the condition one of the following? Then it asks you, would you like to answer these questions now? Again, if the response to your question is something like alcohol abuse, mental health, or substance abuse, then click No and the information will be saved. If, however, the response to your question is physical medical and you did intend to answer the sub-question, click Yes, go back and answer the question, and click Save. If you are updating an existing disability record for a client and simply adding the defining question, click the pencil next to that disability record. For instance, here is a physical disability record. If I click the pencil, I'll note that this question has not been answered. Now I can go in, answer the question, and the information will be appropriately attached to the date of the actual record set. In other words, this is now saying that the client's physical condition was diabetes back on 1/1/2008. Click Save. So now what happens next? Begin collecting this data on new clients and recording it in ServicePoint. Update any documentation about what is being captured and update this information for existing clients. This concludes the update presentation. Please contact the County Help Desk at 240-777-2828 or email at helpit@montgomerycountymd.gov if you have any further questions. Be sure to have your name, email, department, application, and specific details of what you need assistance with. This video was a presentation of the Montgomery County Department of Health and Human Services and is intended to provide information regarding the specific ServicePoint application settings for the county. While it is intended to aid in your understanding, it is in no way considered a substitute for required training. Contact your agency administrator if you have questions about what the requirements are.